Stepped care is an evidence based stage system involving a series of mental health interventions. Basically, stepped care is a fancy way of saying that there's lots of different options of treatment and support for mental health, specifically for eating disorders. Based on each person's capacity and needs, the intention of stepped care is that each person starts on the step that would be most effective but least intensive for them. Program intensity can then either be stepped up or stepped down depending on each person's needs and how those needs change over time. The exact steps in stepped care can differ between organizations depending on the organization's size, needs, and capacity. I'm going to walk you through the stepped care model that incorporates St. Joe's and Body Brave's eating disorder support and treatment programming. In this model, step 1 is considered the lowest intensity, while step 8 represents the most intensive form of care for eating disorders. Let's get started. Step 1, self-guided support. This step is the entry point of care at Body Brave. Body Brave's recovery support program provides clients with rapid access to low barrier resources, information, and supports, including interactive, psychoeducational, skill building workshops, and additional opportunities for learning. The program includes evidence based self reflection activities, recovery resources, personal check ins, as well as our live and on demand recovery sessions and workshops. Step 2, community based group programming. This step can involve group programming at any community based organization. Body Brave's evidence based, professionally facilitated treatment programs are 10 weeks long and include skill building and insight development. Limited to 15 participants, these programs require a stronger commitment than the previous level. And there are additional community based organizations that offer similar programming that you can explore. Step 3, community based individual programming. This step may involve individual psychotherapy or clinical guided one-on-one self-help. At Body Brave, we offer a limited amount of individual treatment services provided by our medical professionals. Step 4, hospital-based outpatient programming. St. Joe's Eating Disorder Program offers interventions at this level. St. Joe's offers comprehensive evaluation and proven treatments to help individuals with eating disorders that may include both psychological treatment and medications. In this step, interventions offer support and guidance, but a client must believe that they are capable of making changes without supervision. Otherwise, it might be best to consider moving up a step in the stepped care model. Step 5, hospital-based intensive outpatient programming. Intensive outpatient programming are treatment programs designed for individuals who need more structure and intensive treatment than they are receiving from standard treatment options, such as one-on-one therapy, medication, and support groups on their own. The specifics of the program differ between the organizations hosting them. Step 6, day hospitalization. A day hospital is an outpatient facility where a client attends for assessment, treatment, or rehabilitation during the day, and then returns home or spends the night at a different facility. For individuals who need a bit more support than hospital-based outpatient programming can offer, day hospital programs can be a great option. Step 7, residential treatment. Residential treatment often offers more long-term, 24-hour support for individuals struggling with eating disorders, but often not for those who are in crisis. Residential treatment is often a fairly limited resource across Ontario. Step 8, intensive inpatient programming. These inpatient programs offer the most intensive form of mental health support. Clients reside at the treatment center where they not only go about their daily life in a supportive environment alongside peers, but also receive frequent support from specialized medical staff, therapists, and other mental health experts. Stepped care is designed to help ensure that every person struggling with an eating disorder gets the appropriate care that they need, and that they continue to receive support that meets their needs as they navigate the healthcare system and eating disorder recovery. To find out more about what level of stepped care might be most appropriate for you or your patient, please reach out to info@bodybrave.ca.